Hi there, I'm Kelly Dean from the Tummy Team, and we're going to show you how to check yourself for a diastasis. We have a lot of information about what a diastasis is, all the symptoms related to it at thetummyteam.com. This is just going to be a quick video on how to self-check yourself, okay? So, first thing you're going to do is lay on your back. So we do what we call a sexy slide, where you slide on our side. And then in this position, you want to put your feet up so your back is kind of straight. You're going to take the pads of your fingers and start right at your belly button. And it's important to not be jabbing down, but laying your hands flat on your belly. And sometimes you can already feel a separation here. Other times you might need to have two hands because it's very difficult. But most of the times, if you just press down right at the belly button, you can kind of start feeling a little bit of a gap if you have one. Then I'm going to have you just barely bring your head up and feel what happens. Can your fingers fall into a gap between the two sides of the outermost muscles? We want to feel that measurement right when you first lift up. So if you need to put two hands or even widen your fingers, some people have very wide diastasis to start with. Sometimes people have a smaller diastasis. Sometimes you can just fit like 1.5 fingers in the middle. That's pretty close to closed. One finger and feeling the connective tissue at the underneath is pretty much a healthy connective tissue, depending on some other symptoms that you might be having. So you're going to check here. You're going to check how many fingers and how deep you can go. So the number of fingers that you can put between the two edges is the number. And then how deep is, can I feel any connective tissue? Does it just go soft way in, or is it very deep where I feel organs and pulsing and stuff like that? And that just tells you how thin the connective tissue is. And then we're going to go about 3 finger widths below. And you're going to do the same thing where you lift up, not too high, just enough so you feel the muscles engage, so you can feel the edges of the border. You're going to put a measurement there, and then about 3 fingers above, kind of underneath your sternum, 3 fingers above your belly button, and you're going to do the same thing there, where you just lift up. Notice I'm not lifting all the way up. I'm just lifting my head up just enough to get those external muscles to engage. And this is a good way for you to feel like, are these muscles connected, or do I have some softness or some separation between the two sides of the muscle? Now, we do not expect you to be an expert on checking yourself. It takes years of palpation practice to really get a good understanding of what's going on. But this is a good way for you to feel like, oh, what is happening here? How much is there a separation of my abdominal wall and how much isn't? And to guide kind of your improvement as you're doing rehab. Now, what's really important is that you're not checking yourself repetitively multiple times a day or even multiple times throughout the week. This is very vulnerable tissue, and you want to be gentle with it and allow it to heal without you poking at it over and over again. Be gentle with yourself. We're trying to assess something, not dig in and be really aggressive, okay? So hopefully that'll help you get an understanding of if you have a diastasis and how big or how deep that diastasis is. There's a ton of information about diastasis recti, how we treat it, all the things that are connected to it, what's really going on with the muscles at thetummyteam.com. So check out what we do there. Okay, thanks so much.